So good morning, everybody. It's really amazingly nice to see such a great group of people here, welcoming group of people here for this really extremely important event. Today is all about hospitals against violence. And, when we think about violence in the communities that we serve, a lot of people talk about the violence that happens in the hospital, the assaults that happen in the hospital, but hospitals across this country are focused not only on the violence that happens within the four walls, but the violence that can occur in the communities. And they're doing some really innovative and exciting things to go after that. And you'll hear about some urban hospitals that, or inner city hospitals that have healthcare workers that are actually intervening when gang members come through the door and they're injured. It's an opportunity to try to really help to reduce violence in the community. In our situation here, our focus is primarily on what's happening inside our four walls. And I can tell you that I'm standing here today and I'm passionate about this because I've seen it. As a person who's worked in hospitals for my entire life, I started as a patient transport and orderly. And so when one of those things that you do in that job is you respond to PERTs throughout the hospital. And it was up until very recently that I maintained my de-escalation and response certification. I think I let it lapse about a year ago. And I can tell you, even as recent as a year and a half ago, I responded to PERTs in this hospital. And sometimes at night, sometimes, when you really didn't know what to expect. And that experience, the experience for the staff and the healthcare workers when they arrive, for example, into an ER where you really don't know the patient, you don't have that understanding of the patient, they may have just come through the door, and you're going to hear a lot more about the ways we deal with these issues. But I do remember one night I responded to the ER, and there were literally, I think, 6 healthcare workers there responding to a PERT. And usually when I would respond, I would find myself in a group of individuals and feel safe and feel okay that we were together, we're educated, we know how to respond, we know how to de-escalate a patient. But in this particular case, I was terrified. I turned the corner in the ER to go and support, took my tie off and was ready to find gloves. And I looked at the situation and I was afraid. And in that particular moment, I started to think more and more about how it is for staff, for people who literally get into this environment, into this field, because they want to heal people, they want to take care of people, they want to make people better. And they're treating patients with that in mind, and all of a sudden, something else happens. And not only is it not okay, but it changes the entire environment, the dynamic for not just the person that's in that treatment room, but the folks around them, the resources that are consumed. So for me, it is personal, and I just don't feel that healthcare workers should, in fact, be put in those situations. And so you're going to hear a lot about this. But one last, comment I would say that really startled me is I met with Police Chief Gould, who's up here, a couple weeks ago, and we were talking about the instance of violence, which by and large has been underreported. Staff feel like, in many cases, that it's an expectation. And so I made a comment, and it was not I don't want to say it was an appropriate comment, but I said to the police chief, well, you get into to be a police officer, and you kind of expect that you're going to get assaulted. And he stopped me and he corrected me, and he said, no, Kurt, that's not an expectation. That is not. We understand it's a risk, but it is not an expectation, right? And it's a hazard of the job, but it is not an expectation. It is not what we as a civil society should expect anywhere that we are, right? And so that startled me, because the same is true for all the folks that work in the hospitals across this country, the folks that dedicate their life to doing the really passionate work that we need to have done. So, and then you couple that with the issue of the shortages that we face. We face extreme shortages of healthcare workers. We need people that are going to come and want to be working in our environments to take care of sick people. And when those things happen, and it's not just, and you're going to hear more, it's not just physical assault, it's verbal assault that happens each and every day. It turns people away. And, someday all of us are going to need that care, that attention, that nurturing, that comforting, that incredible outcome. And we may not have it because our younger generations aren't going to want to be in this field. So to start us off today, I want to start by opening up and recognizing some of the folks in the room that are here today. First and foremost, our Lieutenant Governor, Nancy Wyman. Nancy, and I'm going to say this right, started as a radiology technologist.
X-ray technician.
Yeah, for me, I have to be careful about the appropriateness. And so above all, and what I've seen with Nancy and her focus on healthcare, her chairing the healthcare cabinet for the state of Connecticut, she is passionate, she's engaged, and she's incredibly smart about healthcare issues. And I know you're going to be moving on, and we're going to miss you. Absolutely miss you. So, Nancy, thank you. We're going to count the minutes and seconds, all right? So, because it's not going to be the same. Thank you. Representative Chris Siogas is in the back of the room here. Representative Whit Betts is over here on the side. Representative Dr. William Pettit is here. And then I would also like to introduce our board chair, Doug Devenue, and the vice chair of our board, John Lodovico, who's, they both volunteer so much time. The members of the hospital team that are out here, and Chris, help me, did I miss anybody? I'm sorry. Kim. So, representative from Kim Mortone from OCA, thank you for being here today. Appreciate that. So to start this off, it's really important to understand that the American Hospital Association has been dealing with this issue. The Hospital Association, our Connecticut Hospital Association, representatives are here as well. This conversation has become much more on the forefront. I am part of the American Hospital Association's Regional Policy Board 1. We've had multiple focused discussions around this issue. I'm also involved with the American College of Healthcare Executives. They are also focused on this issue, as are the nursing societies, organizations across this country that really care about developing the future healthcare givers of this country. So to start this off today, I'd like to show a short film that was developed by the American Hospital Association. So in that moment that I had those feelings, I was terrified, I was scared. The thing that I saw, and the thing that I think that people don't realize, is that people can exhibit superhuman powers, and they actually have them. We all hear about, the parent who can lift a car because their adrenaline helps them lift that car off that kid when they see their child there. Some of the things that happen in our societies, some of the drugs that people take, actually give them those superhuman powers, folks. It's real. And when you see it, it just takes you away. You go, how is that possible that somebody that looks like that can actually have that strength and that ability at that particular moment, right? And that's the thing that caught me the most, was that witnessing how a person who I would have thought couldn't possibly do the things they were doing were able to do them. So you need to put yourself in that moment, and that's the moment that our healthcare workers see all the time. And that is not okay for us. It's not okay as a society. So I'm going to start off by welcoming, again, our Lieutenant Governor, Nancy Wyman. Thank you.
Kurt, thank you very, very much for your leadership and for bringing everybody together again. I will tell you that Kurt has done an unbelievable job, not only for this hospital, but for the state. He spends a lot of time here. I'm not going to say anything in front of the board members, but he does a lot of time at the Capitol, which is a good place sometimes for hospitals to have a hospital administrator there. And Kurt, thank you so much, and thanks for all being here today. And as I was sitting here, I have a speech, but of course I'm not going to read it. And it's because I was thinking back at the times when you were just talking about how the employees, and as a former employee of a hospital, and when we had cases of violence on the streets in Brooklyn, New York, how when you have a patient come in that had been shot, and how the families are feeling, and the anger between the two sides that end up coming in and having that person, probably most of them dying after the gunshot wounds, how the families on the two sides would start to fight, and how the staff had to kind of slow things down before they tried to bring and separate people. And the stress of that alone for the individual worker is very tough. But the violence that could come from that, until we get the police from the hospitals in there, it is really stressful. But it's not that anybody gets hurt violently, physically, but mentally. And it's something that will stay in your minds forever. And so I think when Kurt says that he got nervous at that one time, you come every day, you come in and you say, wait a minute, I've got to slow down a little bit, because what if it happens again that happened the day before? So what we're doing now, you are doing now at the hospital, the American Hospital Association, I thank you and the locals for doing this, because the stress that's going on in this country today, the violence that's going on in this country today, hits everybody. Hits our students, hits our businesses, and of course hits our hospitals. And I think by looking at what's going on here in the hospitals to start preventing any of this violence and making sure that our staff is working well, that we have an opportunity to spread the word that, violence is not the way to go and what we should be looking for, you are going to make this a better state and a better country. So I want to thank you all for doing this. This is really very, very important. And God bless you all, and please, let's try to get this right.
Nancy, thank you very, very much for that. The healthcare cabinet for the state is really focused on trying to inflect that cost curve and make healthcare more affordable, more accessible for our state, and similar work is being done across the country. And I think that one of the things that people don't often think about is the cost to an organization. How much cost is being layered onto the cost of healthcare through our response to the violence that occurs in our community, the violence that occurs, the assaults that occur within our organization. Just in last year, you're going to hear we added a tremendous amount of safety and security issues, which cost a lot of money. Hospitals have been viewed as, kind of soft targets. Hospitals have changed dramatically in terms of restricting flow, restricting visitors, visitors that potentially, over time are beneficial to patients, but because of the situation, you have to restrict. So I just put that out there. The cost of what's happening is really contributing to an increased cost of healthcare. To kind of put a face around this, I'd like to introduce to you two individuals on our team. Michelle Miranda, who's the Director of Inpatient Services, and Jennifer Foss, who's the Director of Nursing Operations and responsible directly for the Emergency Care Center. So, Michelle?
75% of workplace assaults occur in healthcare and social services settings like the counseling center. That means we have 3 times the number of assaults in our environment than all of the other workplaces combined. This means that our employees come to work every day. These are people who have dedicated themselves to taking care of our loved ones, our families, and they come to work and they're afraid. They are, especially in the emergency department. So at Bristol Hospital, we have made a commitment, and Kurt has been awesome in supporting us and making sure that we have what we need. We're very involved with the CHA group that Carl and Ellen will talk to you about. We have several leaders that participate in that. As a hospital, we've formed a workplace violence work group that has both leaders and staff involved. We started off last year with focus groups to talk to our employees about their experiences when they were assaulted. What happened before, what happened during, what happened after. We got some really good feedback. We've continued those meetings monthly. We debrief on any incidents of assault, and we identify actionable items for improvement. Some of the things we've put into place so far is we've improved our reporting process to make it a little easier for our employees to put the information in the system, make sure we have all the accurate information. Our aftercare has improved. We still have work to do, but we've set it up so the nurse manager always reaches out to that employee, and the occupational health nurse always reaches out to that employee to make sure they have what they need and if they need anything additional. In addition, we do safety huddles. I think most hospitals do them now. We do a hospital-wide safety huddle, and the units do safety huddles twice a day. And we always talk about any recent assaults, how many days it's been since our last assault. We talk about what we can do to support each other when those things happen. And that's a daily occurrence here. CPI training, that's de-escalation training. Previously, this was only mandatory for what we considered our high-risk areas, such as the ED. We now offer it to all employees, regardless of their role or their unit. So, in addition, in January, Bristol Hospital began reporting data to NDNQI so we can benchmark ourselves against like hospitals, so we can understand better how we're doing with this problem, because it's really serious. Some of the things that we have in process right now, we're working on a violent patient alert that we will have in the EMR to alert staff to someone who has had a previous incident of violence against a healthcare worker. And we are looking at some way to assess patients who may be at risk of becoming violent. Right now we're looking at what's called the Brosette Violence Checklist, which is pretty well researched and has been shown to be effective. So we're looking at that. So in a nutshell, we want to prevent assaults. When they do happen, we want to make sure they're reported accurately and reported in a timely manner. And then we want to make sure that we respond as a hospital appropriately when those employees are assaulted. Now, obviously, the emergency department is our really high-risk area, although we do see quite a bit in the inpatient areas. So Jennifer is going to talk to you about some things that she's been working on and her staff have been working on to help her staff be more safe downstairs. Thank you.
Good morning, everyone. Thank you for coming out today to support us on this journey. As a leader here at Bristol Hospital in the emergency room, one of my primary focuses is on keeping our staff and our patients safe. It's something that we take very, very seriously here, and putting evidence-based practice that's supported by leadership has been our #1 focus. So what we started with a heat map, and we wanted to look at both, okay, what physical changes need to be made and what cultural changes need to be made. So we started with the heat map, security guided us through that process. We were able to identify what are key times where our staff is being hurt. With that information, we were able to identify that the evening hours, primarily 5 p. to 1:30 a, were when most of our assaults were occurring. So partnering with leadership, we were able to make a very nice case for why we needed a security officer dedicated to the emergency room. So since we've done that, we've seen a dramatic decline. Sometimes all you need is someone in a uniform. Just like they'll say the white coat syndrome, as soon as somebody walks into the room, sometimes patients will calm down. Well, sometimes with aggressive and violent patients, when we have somebody with a uniform walk in, it's a wonderful deterrent. So while we've seen a decline, we all know that if there's one injury, it's one too many, so we will continue to work very hard to do this. Another thing that we've implemented aside from that is a panic system in the emergency room. So if our staff are feeling unsafe or that there's a potential for violence, our staff have it's attached to their clothing, they can push the button and it goes right to security, so security can come and give us the assistance that we need. We've also directed flow so that we have the ability to lock down the emergency room if we need to, which is something that we didn't have before, and this is huge. Being able to lock down a facility is something that every facility needs to do, so thank you for allowing that to happen. Aside from the physicality of the building and how we help physically, there needed to be a culture shift. I think, as several people have alluded to, sometimes when you work in healthcare, people think that it comes with the job. It does not come with the job. We're in healthcare because we care for people, and that's what we want to do. As somebody pointed out to me, it's the verbal abuse that can be draining too. So expressing to staff that if there's something that happens verbally or you're verbally assaulted, please log this, because we know that this is what contributes to the turnover, especially in emergency department nursing, and we really want to capture this. We want to know how often is this happening. Before I started working in the emergency room, I didn't know that was one of the major causes of turnover. You know, the violent stuff you can really capture, and it's very concrete, and you can put an action plan in place, and you can work really hard to decrease that. The verbal stuff, being cursed at and the eye rolling and the name calling, that's the stuff that wears at your spirit, and that's the stuff that we're really trying to make better as well. So, any questions? No. Thank you.
Just to add to that, one of the other things that I feel very strongly about is supporting our staff when they are assaulted, in actually working with the police department to press charges and actually show up in court, which often for the staff is very difficult. Some have young kids, they have spouses that work, and coordinating that can be problematic. You can go to the courthouse and all of a sudden it gets delayed. And so we've made a commitment to the staff by saying that not only will we give you the time, you know, we're going to pay you for that time to actually go and follow through with this, because I think that following through, and more frequently we've seen the results of convictions and actually people really having to be responsible for their actions. Those things have shown up in the newspaper more recently. I think that is an important message to say that there's really going to be a zero tolerance here for those kind of actions. It means that the staff has to stay together with that too. So, you know, one of the problems is someone may say, I'm not going to do the reporting, or, it's part of the deal. And then another person feels very differently about it. Getting everybody on the same page about that, about going through the process, is critical, and I think really important to us evolving the understanding in the community and making our environment more safer. So hopefully I didn't steal anybody else's thunder on that. Okay, good. And so the other component that is really critical, and you see this throughout the country, is the collaboration and coordination with the police department. About a year ago, we were celebrating EMS Week, and so we had a group of EMS workers from all over the state here in the hospital, and it was at that point I really got to see and recognize how amazing our police department is. I heard stories from other EMS groups where they are the first responder. They are going into situations where it is potentially very unsafe. Here in Bristol, we have this incredible collaboration with the police department, and typically they get to the scene where there's a medical emergency before we do, helping to ensure the safety of our EMS crew, which is really very crucially important to us. So, Chief Gould, would you like to come up here and say a few words? Thank you for that.
Hi, good morning. Thank you for being here with us today to help bring awareness to hospitals against violence. I'm going to go off script here too. I think everybody's kind of talking, and one thing I'm noticing, you're going to see an absolute theme here. I think everybody's passionate about it, hearts are in it, and we know it. I've had the fortune of serving this great city for 24 years now, so I started on the front lines, and like Kurt was saying, we are first responders here in Bristol, so we are on the scene first, and we're providing medical attention. That's what we're trained for when we go to the academy, and we come out as what was known as medical response technicians back then, EMRs now. But so we maintain that cert, and we continue with all that. And the discussion Kurt was talking about last week, I feel strongly with too. There's just this belief that people in these types of professions are, it's okay to put your hands on them, commit violence, and that's absolutely not the case. I don't know a police officer that I've ever talked to. I can tell you that when I came on, I understood what I was getting into. I understood that there is a high risk. I understood that I wanted to serve our people, serve the public, and if I had to put myself in harm's way, I'm committed to doing that. But I never sat back and said, you have the absolute right to assault me, and therefore you don't have the right to assault or commit an act of violence against anybody else. It's just wrong, inappropriate, and what I'll be talking about a little bit today is some of the things that the great state of Connecticut has done to help out with penalizing people for doing so. So I have a strong passion with this as well. In 2010, probably many of us, there's so many acts, as we were talking with Lieutenant Governor earlier about what's going on in the nation. We're seeing so much, and it's not the nation, it's the world, these acts of violence. We have so many now that you start to almost lose track. It's unfortunate. But in 2010, there was a pretty horrific incident that happened here in Connecticut at the Danbury Hospital. And this involved a person who went in seeking medical treatment and ended up pulling out a gun and shooting the very people that were trying to help him. One of the nurses stepped in and was shot multiple times and severely injured. What happened with that event is we have always been aware of these patient on staff assaults, but this specific attack really brought much needed attention to the number of these types of violent acts that occur in our health care facilities. We have to realize that every day these providers are on our front lines. They're taking care of you, they're taking care of me, they're taking care of our families and all our loved ones. And we have a duty to take care of them. These great men and women experience horrific events on a daily basis, and what they see is beyond the imagination. For those that don't work in a healthcare facility or are not a first responder, it's hard to put in words what you see. And it's not something you see once, it's not something you see twice, it's something you see over and over and over and over, and you deal with it. So it does take a toll on people. And it's not just physical, it's mental as well. But they continue to come to work and provide this much needed health care while placing themselves in harm's way. You're going to hear it, and I said it over and over. The belief is that this is just the nature of the business, and that is not the case. These people are here to help us, and no one has the right to commit an act of violence against another person, period. The only job that I'm aware of right now is if you're a professional fighter. You understand we're going to sign a big contract, and for lots of money, I'm going to hit you, you're going to hit me, and But other than that, it's not an expectation. In 2011, the state of Connecticut, recognizing this issue, passed a law making it a felony to assault a healthcare provider in the performance of his or her duties. The law was originally known as an act concerning workplace violence, prevention, and response in healthcare settings. This set certain guidelines and procedures in healthcare facilities that were employing 50 or more full or part-time employees. And they had some things that these places had to follow. And just a couple examples, which you've been hearing about, and Bristol Hospital's taking the lead on this stuff. And I can tell you that I've been working with them for a number of years now, so I'm speaking from experience with this. Establishing and convening ongoing workplace safety committees to address issues related to the health and safety of their healthcare employees, and they care very much about their employees. Undertaking risk assessments or the factors that put any healthcare employee at risk for being a victim of workplace violence. Establishing of written workplace violence preventions and response plans, and those are just a few. But from the law enforcement side, it established that if a person committed any of these following acts, it was a felony. Number one, causing physical injury. Number two, hurling or cause to be thrown or hurled any rock, bottle, can, or other article, object, or missile. And you notice that they put all that stuff in there because this stuff happens, of any kind capable of causing physical harm, damage, or injury. Using or causes to be used any mace, tear gas, or any like or similar agent. Throwing or hurling or causing to be thrown any paint, dye, or other like or similar staining, discoloring, or coloring agent, and any type of offensive noxious liquid, agent, or substance. And throwing or hurling or caused to be thrown any bodily fluid, included but not limited to urine, feces, blood, or saliva towards a healthcare provider. And yes, that does happen. They'll be arrested for a felony assault of a law enforcement, public safety, or emergency medical personnel. You see, this law was always in effect, but it was only in effect for public safety and law enforcement. So adding these emergency medical personnel was a great step by the state of Connecticut to help us have some follow-through on this. In conclusion, the Bristol Police Department is fortunate to work with the Bristol Hospital. We value their partnership very much, and we've been working with the hospital for the past several years to strengthen our relationship. Some examples, we've had training in areas of workplace violence and active shooter. We've helped form policy development for police response to sensitive areas inside the Bristol Hospital. And we have trained a number of our officers in crisis intervention so that we can recognize and de-escalate situations out in the community, as Kurt was talking about, so that when they come in here, hopefully the medical personnel have a better time with them. We meet to discuss incidents that occur at the Bristol Hospital and discuss what may be needed to pursue an arrest. You're seeing it all right here. This whole collaboration, it's a unity and a partnership to address these issues. We at the Bristol Police Department will do anything that we can do to assist these great people in working at the Bristol Hospital. The bottom line here is that it's completely unacceptable to commit an act of violence against our healthcare providers. These people are here to help us all, and we, the Bristol Police Department, are here to help them. We talked about the follow-through with victims. That's so important. That's part of the training that we're doing here is to report it. And the question comes up, and I think there's a lot of under-reporting. I agree with that. I think sometimes people think that it's part of my job. So how much should they reporting? Well, my position as a police officer is report it. We'll figure it out. We'll figure it out if it meets the statute. And if we have probable cause, we'll pursue an arrest. So in conclusion, we appreciate our healthcare providers very much. And thank you for having us here today to partner with you all. Thank you.
So I think you can feel the passion and the collaboration that we get from the local PD, and for that we are very thankful. In fact, would you mind coming back up here again?
Absolutely.
So, in recognition of that incredible collaboration and support that you give us, and the response, all of it, and everything that you said, we would like to present you with this Hospital Champion Award. For your,
thank you. This is an absolute honor and a privilege. It did not need to be done, Kurt. We're here for you. I'm here for you. But I will treasure this. Thank you so much. I appreciate it. Thank you.
So now, so part of what you heard in the conversations was a collaborative. Connecticut Hospitals, believe it or not, you may feel that we're very competitive, but there's a lot of things that we collaborate on, and we do that very, very well. And this is one of those areas where we collaborate. We've had a variety of different collaborations, and it really does help us all really move in the right direction and providing really high quality, safe care in this environment. So I want to introduce to you Carl Schisel. He's the Director of Regulatory Advocacy, and also Ellen Crow, Director of Clinical Excellence and Care Redesign from the Hospital Association. Carl.
Good morning. Thank you, Kurt. Governor, thank you. Ladies and gentlemen on the panel and everyone here. I wanted to begin by offering congratulations to Bristol Hospital on their efforts to reduce violence. Some of the innovations that Michelle and Jennifer described earlier today are being spread to other hospitals through the initiative you're going to hear about. And also, they are participating in the collaborative and will be learning what's going on at other hospitals around the state in order to make sure every Connecticut hospital benefits from our shared experience trying to combat workplace violence. Second, I'd like to congratulate and thank Kurt Barwas for his leadership and frankly for his inspiring words this morning. I think he put it into context very well, why we're here and what we're intending to do. And also, Lieutenant Governor, I wanted to thank you as well for sharing your experiences. I think it just brings it to life, the work that we're doing here today. So thank you for that. And then finally, a note on Kurt Barwas. He talked about cost earlier, and one of the things I like about Kurt is he puts his money where his mouth is. And in short, his CFO is actually engaged as a participant in our statewide initiative. And I want to thank you for that because you can come up with all the great ideas, but if you can't figure out a way to pay for them, nothing's going to happen. So thank you very much for that. We appreciate it very much at the Connecticut Hospital Association. So this panel here represents local, state, and national representatives of the hospital sector taking a stand against violence. And as Michelle mentioned, according to the Occupational Safety and Health Administration, healthcare workers are at an increased risk for workplace violence. She mentioned that 3 times is at risk, but you've heard other speakers talk about how workplace violence may be underreported in the hospital setting. It's part of the job to, get spat on or things like that. So part of this statewide Safer Hospital initiative that CHA is spearheading with our hospitals is to try to get behind some of those myths and get to the truths. And we suspect that as has been indicated, there may be actually more incidents of workplace violence in the healthcare setting than are actually reported by the Office of Safety and Health Administration. So we've established that this is a nationwide issue, that it's not a new issue, but here in Connecticut there is something new. And that new thing is a coordinated statewide initiative sponsored by the Connecticut Hospital Association and inspired by every CEO of every Connecticut hospital that's a CHA member, known as the Safer Hospital Initiatives. We believe that this Safer Hospital Initiative is unique in its broad and comprehensive approach to addressing this problem. The 3 goals of the Safer Hospital Initiatives are, number 1, as you may suspect, reduce the incidence of workplace violence in hospital settings. That's goal number 1. Goal number 2 is to increase worker safety by addressing at the outset the 3 most common forms of injuries to healthcare workers. And Ellen will describe in more detail what those are. But worker safety isn't just protecting you from violence, it's making you safer in all the things you do on the job. And that's an important element of the Safer Hospital Initiative. And finally, and I think this is a fairly unique factor, we are pursuing the establishment of peer-to-peer support programs to support workers who experience trauma, whether it's workplace violence related or not. And this sort of gets to the situation that Jennifer mentioned, the toll that the day-to-day grind takes on you in your job, and to establish as a matter of sort of institutional and corporate culture that there'll be a place where you can talk to your peers and share your experience. It might just make hospitals a better place for these people to work. And so at this point, I'd like to yield to my colleague, Ellen Crow, to discuss aspects of the initiative in greater detail. Ellen, the floor is yours.
Well, thank you, Carl. So I work with Carl at the Hospital Association, but I am a nurse, and I have been a nurse for 33 years. And so this is a topic that has been very near and dear to my heart, and I would want to participate in nothing more than this. So I wanted to echo Carl's congratulations to Bristol Hospital and their leadership. Bristol Hospital has been instrumental in the Safer Hospitals initiative. And so I wanted to just give you a flavor of what that statewide initiative is and how groundbreaking it really is in both its structure and, to Carl's point earlier, how comprehensive it is. It actually has three very distinct elements. The first element is to reduce workplace violence, and violence both physical as well as verbal. So that is our very first focus. The second focus is to increase worker safety. Carl mentioned the most prevalent injuries amongst our staff. We've identified those, and we're going to look at best practices and strategies to really reduce those injuries for our workers. This means the safety of every worker in the hospital, no matter what their role is, clinical or non-clinical, everyone in the building. The third element is to support the workers who experience trauma. That trauma occurs in multitudes of ways. It can be trauma from having experienced violence directly, and that's been spoken about earlier. It can be trauma from having witnessed an extraordinary or traumatic event. As part of their job, such as a patient death or a patient not doing well, it really wears on the worker. It can also be trauma from being involved in an adverse event. And all of these aspects affect both the personal and professional lives of these workers profoundly. We have to remember that healthcare is certainly a stressful environment, with or without this added layer. We need to make sure that our workers have the support they need to continue working in this field and thriving in the careers that they chose. We don't want to lose valuable team members, people that bring the experience that we're all going to need them to have someday. We have known for many years that violence in healthcare is an issue. And we've been talking with hospitals about it for quite some time. The Safer Hospitals initiative is a natural outgrowth of all of those conversations. So we have been listening. We have been out in the field, and we have heard all of the stories, and we are now, and have been for the last year, taking action. Some of the things that we're doing include a focus on training. Training staff is essential in order to recognize situations that perhaps could become aggressive. Learning how to de-escalate situations, and particularly in areas outside of the traditional areas like the emergency department or psychiatric behavioral health areas. We need to give the staff the tools that they need. As part of this work, we're instituting peer-to-peer support. Carl mentioned this earlier. This is a program that will provide a high level of support to staff members who have experienced trauma on the job to help them cope and continue to flourish. Again, this is important for the well-being of staff, and we want every staff member out there to be retained because they are critical to our missions. And simply, it really is the right thing to do. I want to thank again Kurt and Bristol Hospital for their leadership in this issue, as well as all of the other leaders I see in the room who have been actively participating in this statewide initiative. We certainly could not do it without you, and helping us make this a successful journey as we continue our work. We'll be happy to open it up to any questions.
You left out.
Thank you.
Thank you very much. Again, the Hospital Association really works hard to collaborate, help the CEOs, help the hospitals. There are members of our team, our leadership team, from various departments throughout the facility who participate in programs to advance the quality and the safety of care throughout Connecticut, and that wouldn't be possible without the Hospital Association. So thank you. The next speaker is Jack Berry, and Jack is the regional executive for the American Hospital Association. He's positioned in Massachusetts. What I can say is that I've had the honor of serving on the regional policy board for the American Hospital Association. Often, you know, you kind of say, until I actually did that, I didn't really understand how policy was set. And if you can imagine all of the different things where the American Hospital Association has to weigh in on policy in Washington, and advocacy that they have to do, it's kind of interesting. And I thought maybe it's like the board here, they just kind of get around and figure out that's what they're going to do. But that's not what actually happens. They have 8 regional policy boards, 8 or 9? 9 regional policy boards. So New England has a regional policy board where executives and actually board members from hospitals, so volunteer board members, come together once a quarter. We spend a good part of 2.5 days going through policy issues at the same time as the other 8 regional policy boards are doing the same kind of work. And I find personally, I'm kind of selfish about this, and I keep saying to Jack, I want to stay on that policy board because in literally about 2.5 days, you have to digest more than a binder of information, but you're not just getting the information, you're actually interacting with hospital executives and governing folks from around the region, and you're debating the issues and the topics and what is the position going to be. So those 9 regional policy boards send their feelings, their determinations, which could be quite different from the West Coast to the East Coast, to the governing board of the American Hospital Association, and then from that point forward, the board sets its policy decisions based on an incredible amount of input and information. So it's an organization that I've grown to respect, and I've known Jack now for almost 12 years, and it was really very encouraging that the AHA came here today and is supporting us in this press conference. And so, Jack Berry, thank you.
Thank you so much for that, Kurt. Really, thanks so much for allowing me to be here. It's one of the, I've been doing this a long time. It's one of the most memorable events I've ever had a chance to be at. Kurt mentioned his participation in the national organization's policy development, and we really appreciate the time and apologize for all the homework we make you do and all of that, but it's important, and I can assure you Kurt is a really important contributor. A lot of things we talk about there are money, you know. Don't quote me on that, please. But I don't think, you know, it's a secret that there's a lot of challenges going on at the state, local, national level around, you know, payment and reimbursement and coverage. We want to make sure every American is covered, and, you know, we could talk about that for the next week and a half. You know, but this, you know, when I go to an event like this, and there's so many smart people talking about doing incredible things, you know, our major partner, the Connecticut Hospital Association's efforts and your efforts here at Bristol Hospital and your collaboration with the police chief is so important. I try to boil it down to one soundbite. Maybe my background is a journalism major. And the thing I'm going to remember is what Kurt said at the beginning: it's not okay. It's not okay for the workers. It's not okay for their colleagues who are, see what's the violence that happens too often. It's not okay for all of us. I think it's a really important point for America's hospitals. We are facing a demographic challenge. We are, newsflash, not getting any younger as a country, especially in parts of New England where it's actually more people over 80 than any, Maine and New Hampshire, than any states in the country. And we need the best, brightest, most committed young people to go into the health professions to take care of us. And that it's not okay if events happen that discourage that. So I really thank what all of you are doing, especially in this room, and we heard from speakers, but all of you here, just by being here, are showing how important it is that we address this and talk about it openly. AHA made a commitment to address to create hospitals against violence about 2 years ago. This is National Hospitals Against Violence Day. If you go on social media, hashtag HAV Hope Friday, you will see other hospitals across the country doing events and putting things up on their websites and all that social media stuff I don't understand, but you all do. I would urge you to take a look at that. Part of what we do as an organization of 5,000 hospitals or in systems is make sure that best practices are shared across the country, and I can assure you we will certainly share the real leadership that is exemplified in so many ways with just having this event and talking openly about this subject. We also, by the way, are concerned obviously about violence as a broader public health issue. Hospitals have made a commitment to be more than just a brick building where you come when you're sick or have had an accident. We are increasingly going out into the community, into the homes, trying to, yes, get people who overeat or smoke too much and do things, text while driving, to stop all of that so they won't come into the hospital. And we have a stake in finding ways to reduce violence. It is a public health issue. So the AHA board created Hospitals Against Violence a couple of years ago. We have a lot more to do as a society, as a community of hospitals. And I just also want to mention, I get back to the money for a second, and some of the speakers referenced that we actually did a study, or commissioned Millman Associates last year to do a study, violence inside and outside the hospital created $2.7 billion in the country in non-reimbursed costs. And that, that's an important aspect. We're trying to provide health care for America in an affordable way. So again, I really appreciate as a patient, as a family member of caregivers, and even a prosecutor, how important it is that we not forget the message, it's not okay. And I really appreciate all your work and your presence and commitment, and especially the leadership of Kurt and Bristol Hospital. So, thank you.
So, do you have any questions for anybody on the panel? Any concerns that we didn't cover? Marie Spivey.
I just want to say this is absolutely incredible and wonderful, all the work that you're doing. The thing that we forget about is we talk to the choir, and so with all of us talking to each other doesn't really solve the problems on the outside. And the partnerships, I mean, I look at partnerships throughout Connecticut, especially because all the hospitals are working with community-based organizations and schools, but that is part of this Hospitals Against Violence. So if your partners know what you're doing inside the organization, they can be very helpful on the outside. And I urge you to talk more with them about what you're trying to do, and then ask them what you should be doing.
Thank you, Dr. Spivey, for that. I absolutely agree, and hopefully with the presence of the press here and getting the word out, if there are those that are curious about what we're doing, and we can share how we're approaching it in the community, we certainly want to partner with them. So that was right on point. Thank you for that. Anybody else? John?
And it's not okay. It's not okay. And we should have signs all over the place to bring awareness to this problem that we have. To me, it's an epidemic. I think our emergency room alone, and I'm Italian, so I'll exaggerate, over 30,000 visits a year.
It's almost 40,000.
Okay, I'm not exaggerating that.
You're
I'm
really
good.
good.
Okay, and out of that, with that amount, how many are violent? How many acts are violent? How many acts are assaults, verbal? I mean, these are
It's a lot,
my slang. They're in
unfortunately.
the trenches on this, and we need to help them. And we
Yep.
can, and I know we do. I know we do. So that's why I'm so proud to serve on this board.
And we couldn't do it without the volunteer time, intelligence, commitment that our volunteer board members provide to us, John and Doug. I mean, if you actually added up all the hours that they spend in meetings and really helping us think about the future and where we need to go, I would venture to say it's probably a second full-time job by the time we get done. So thank you for that. Anybody else? Dr. Pettit?
In terms of funding, Carl spoke to it early, saying that you put your money where your mouth was. What does the AHA think? Should this be funded via the AHA, via the CHA versus local hospitals, or on a federal or state level? My comment is that it's another one of these issues that I don't think money will solve. It's a social issue that requires a change in attitude, a change in socialization, improvement in family structure, et cetera, et cetera.
I don't believe that we're specifically suggesting or asking for any more funding. We think this is something, if we do it right, we will save money, and the studies would prove that. If we could prevent workplace violence through what the previous speakers talked about, and identifying it and addressing it and saying it's not okay, we can reduce the billions of dollars that it's currently costing us that we don't get reimbursed for. So, I think I would hesitate to want to say, give us more money and we'll take care of it, and I don't want that to be the message. I think the message is we are committed to doing it, and we need help from everyone in saying it's not okay. And the police chief and others talked about how we say that and how we behave that way.
Jack, what you say is really true. We've seen it in other areas. For example, adverse events or patient safety, where there's initially the collaboration, the focus, the training. We trained every single person in this organization. Every healthcare worker in the state of Connecticut has been trained on and given tools on how to become more reliable. Every physician has gone through the same training. And when you first go into that, it's very expensive. I mean, to bring in the organization, the consultants in to design the program, and then think about if you took every single person that works in a hospital or a hospital entity in this state have gone through at least a 4-hour training program, how much that cost. I mean, it's huge. But then, if you play that forward a couple of years and you look at the results in terms of avoidance of serious safety events and the cost avoidance related to that, it's time. So I do agree with Jack. I mean, when we added security, when we added, when people unfortunately get assaulted and get injured, there's workman's comp costs associated with that. There's lost time from work. We may have to hire travelers to replace those people. So I really do support what you're saying. I think that what we're trying to do is what we did with patient safety, which is to get to the point where the future looks very different than the present. But I think the acknowledgement of the fact that it's, we can't just look inside our 4 walls. It's a collaboration, and it's going to take the state, and thank you very much for passing laws that help us show that real consequences occur to folks when they injure people. So anybody else?
Since implementing the support groups and such, if you've seen a increase in the retention rate now that they have more people that can support them after these incidents occur?
We actually have an improvement in our turnover rate. I can't say that I can attribute it to that at this point in time. I think we are still clearly challenged in many areas, and there are many areas where, you know, we have severe shortages. I mean, there is no training program for scrub techs in the state of Connecticut anymore. I mean, that's just unbelievable. I mean, you know, and so there's a variety of issues with turnover. There's high demand for some of those jobs unrelated to this issue, but I don't know. Do we have any specific? I know we saw a significant reduction in assaults, which is ultimately, I think, going to contribute to that, but I can't point to hard data at this point. So, other questions? Yeah.
What was the moment that made the two of you realize that actions needed to be taken and that there was something that really needed to be done?
On behalf of myself, I started here last April, and I asked my staff, so staff in the emergency room, what was the most important to them, and they said that their safety and security was the most important to them. So for me, that was my first actionable item when I started here, and as you have private and individual conversations with people, you learn just how much it means to them, and I just felt how burnt out and tired they were. And it's interesting because even the Joint Commission, their most recent Sentinel event alert, it just came out, I believe it was last month, but they talked about verbal abuse. So it's really nice that the Joint Commission is acknowledging this too. And they had asked that hospitals make a commitment to track and trend the verbal abuse that occurs. So it's really a wonderful thing that, especially an institution like the Joint Commission, that they're taking it as seriously. Because like I said before, you can track and trend that physical abuse very, very easily, but it's that verbal abuse as well that just can become demoralizing.
So the question was, is there an area where the Joint Commission would kind of check off that we actually... So the Joint Commission is our accrediting body, so it's an outside independent organization that comes in and reviews our organization, and it's a surprise survey. It's an intense survey. And in the old days, they used to review policies and procedures, and a lot of their time was spent in rooms checking to make sure our policy said this, that, and every other thing. In the last, I want to say, 6 years, that's not what they do. They do patient tracers. So they would essentially look at our census, they would look at a patient in the ER, and they would start with that patient in the ER and trace them if they ended up in surgery all the way into the inpatient area. And if there was an issue or an interaction where, for example, restraints were considered, where there was a PERT, they may specifically actually target a patient like that. In that particular case, they would then look at all the programs that we have. They would actually get the name of every single employee that was involved, and they would go back to their HR records and verify that they actually had the proper training and certification to be able to actually do the interaction that they did. So the quality of the survey has changed substantially, and you know, they would absolutely integrate. And I think, to Jennifer's point, that they now have a Sentinel event alert focused on this. They are going to look for patient issues where that occurred, and they're going to intensely focus their field work around, are you really doing a good job of responding to this? Are you developing the right kind of things? And they're also very, they provide a lot of education because they go from one hospital to the next, so they would offer a lot of support and help to us as well.
I came to work at Bristol Hospital in September of 2016. I almost immediately became aware that there was an issue. I had access to the reporting system for all the areas, including the emergency department, and I was seeing a number of reports. But in talking to the staff, it became clear that not everyone was reporting, so that was a serious problem as well. So, you know, we have since then done some surveys. We are constantly talking to our staff, and it really came home to me one day when I was talking to one of my staff, and she said, after I was assaulted, I needed counseling. I had to go on medication. I had to take time off from work. And I said, we got to do something. We got to do something about this. And So we are. Still a lot of work to do, but we've seen some improvement, so we're optimistic.
The feedback on safety and the issues that you're hearing, it was prevalent in just about all of those discussions where you were talking about the ER, where you're talking about ICU, med-surg floors, behavioral health. I heard it loud and clear. That's a one-on-one conversation with the staff where they're encouraged, and that's a conversation that happens at hospitals all throughout the country and the state. Specifically, it is a very common way for us to get feedback on what the current issues are, what people's concerns are. So, thank you. Whit, you had a question?
I want to congratulate everybody, and not only on doing this and for the right reason, but one of the things that's very encouraging, and I know the Lieutenant Governor can appreciate this, is you're doing it on your own without the legislature mandating it or making it a law. What I think would be very helpful to us is if you come up once a year and give us an informational update on what you're doing and how the national, state, and local hospitals are working together, and if there's anything we can do to support that, we'd like to. But I think more than anything else is just educate the public and let the public know, as well as the staff know, that in fact you're being proactive, not reactive. And I had not heard or been aware of a lot of what's going on I've heard this morning. And I think more people would feel a lot better knowing that that's going on and that this is a priority.
Representative Betts, thank you. What can we do to really build more awareness around the individuals, the workers that are affected by an assault? And I think that comes with building that support structure. That comes with making those individuals feel safe and comfortable in terms of speaking up. And I think that is vitally important for us to actually develop response systems for those people. I mean, we can't fix something if we don't know about it. And so, like other things, like patient safety events and things like that, part of it is making sure that that underlying culture embraces, supports, encourages, and doesn't, make people feel like, it's somehow their fault, right? You get that right, you start to get the reporting up, and you also start to build those support structures around those individuals. I think we will see more individuals that will speak up and talk about the consequences. Certainly, if they're going to support the legal process for an assault, they're going to speak up. I mean, they're going to give an impact statement during that, or may give an impact statement during that. But I think it's really important that we create an environment where people that have been assaulted, whether it's physically or verbally, can actually have that opportunity. So the more awareness that's brought to it, the more we understand it, I think the better off we're going to be in terms of solving that problem. So thank you for that. Any other questions?
Is there a belief that there's a increased incidence of these types of behavior, or is it more a recognition of what's already been there and it's more of the same?
I know for this organization, I get to know about every one of these instances that gets reported, and I can tell you it's an increase in the number of instances. There's just absolutely no question. 3 in the last week. Okay, so I was here early this morning, and the staff was dealing with 5 issues at one time. So and that may be anecdotal because it's one hospital, but when I go to the Regional Policy Board, this is a discussion that happens all the time at Regional Policy Board. I hear it from all the other CEOs and directors that are in the room. I think that, as you heard from our team, getting the reporting better, reporting not just physical assaults, but verbal issues, is going to help us understand this problem in a bigger way. So my answer, that was a long answer to your short question, is yes and yes. Yes and yes. I think that the incidence has dramatically increased, my observation, and we are also seeing a bunch of a lot of focus, not a bunch of, but a lot of focus around supporting individuals in taking the time to make the report. And I think those are both absolutely incredibly important. Well, we want to reduce to one, but to getting to a better construct. And as you heard, it's a collaboration. I mean, the collaboration we have with the police department. We were talking just the other day about, you know, how do we deal with combative patients that actually don't assault somebody? And this police chief was going through the ordinances and saying, well, actually, you can action on some of these things. You know, where you know, we had an issue where it was not the patient that was combative, it was their support structure that came in and actually assaulted a staff member. But even before it got there, it got a little bit out of control. We did all the things we could try to do, but you know, the truth is that was disturbing the peace. There was a whole bunch of things we could have actioned, and you got to learn those things. We are certainly open and willing, as I said, to collaborate with any organizations, any individuals, to try to help resolve this issue for us and make our environments much safer, our communities much safer. So thank you for being here today. Really appreciate it.